Hi there, this is Priya on this side, and I'm filming this video mainly to help all of you understand what are the changes, the updates in the evaluation criteria. As far as our writing style is concerned, we have always been following all this criteria. It's just that the updates have reorganized the criteria. So some of the criteria, say for example, were being assessed under one heading. Some of the parameters which were being assessed under one heading have been now bifurcated, and say for example, those things are being now assessed separately. So the aim of filming this video is mainly to help all of you understand that basically, as far as OET writing is concerned, nothing has changed. You are still writing a referral letter specific to your profession. There will be one writing task where you'll be given 45 minutes of time and a case notes, and you get 5 minutes time for reading, 40 minutes time for planning, and finally writing your letter and doing the final submission. Still you are being assessed on both the things, your ability to understand and comprehend the case notes, as well as your writing skills, your ability to put it into a formal letter. So as far as writing test is concerned, nothing has changed. It's just that the evaluation criteria that we as a trainer, or that we as a teacher or assessor have been using so far, have been reorganized. I use the term reorganized because they are still assessing the same thing which they used to assess in the past. So to help all of you understand exactly what are the changes, and how you can get good score in OET writing, I'm just going to bring the evaluation criteria on screen so that you can understand each heading, and you can also understand in what ways you can improve your performance on this criteria. So let me just bring the official criteria on screen. Okay, so I have got it on screen, and now let me explain one after another criteria. We are going to look at it, from two perspectives. First, I'll be just explaining you the student's perspective, and then I will help you understand how exactly the assessor will be looking at it. Okay, so OET itself has made this criteria public. Uh, this is the public version of evaluation criteria that I'm referring to. So it is available on OET website if you want to go back and check. Anyone, any student or any trainer who is preparing for OET, or those trainers who help students prepare for OET, can have access to this criteria. Okay, so let us understand first from a student's point of view. Okay, I'm looking at the criteria from a student's perspective in the beginning. Okay, just please bear with me until I'm able to open the file. Okay, so here I am. I have got the evaluation criteria. We're first going to look at it from a student's perspective. Yeah. So here, the first criteria. This, though it was not tested separately in the previous evaluation criteria, this remained the most important criteria always for the assessors to identify whether you could meet the purpose of writing the letter. So what exactly this purpose criteria is looking at is that they want you, the healthcare professionals or the reader, should be able to get a quick and precise sense of what is asked of them. So based on why you are writing that letter, right, that should be mentioned earlier, like maybe in your introduction paragraph, so that a reader gets a clear sense as to why that letter is being written to them. Because as a nurse or as a doctor or as any health professionals, they may be responsible for doing multiple things, that their scope of practice may be very wide. But when you are writing a letter, what exactly do you want them to do for your patient? Okay, that has to be mentioned very clearly in the introduction paragraph. That is what this criteria is saying. It should be, it should be a handover document where very quickly and efficiently the purpose should be mentioned. So it is examining how clearly the writing communicates the purpose of the document to the reader. It should be introduced early in the document and then clearly expanded on later, often near the end of the document. Okay, so most of the students have this confusion. Do I need to write everything that I want them to do in the introduction paragraph? Say, for example, if you're writing to a nurse who is responsible to do multiple things for your patient. So is it necessary to say all those things in the introduction paragraph? No, of course not. In introduction paragraph, you just need to provide a brief idea as to exactly what they are supposed to do. For example, you could say that I request you to arrange home visits, or I request you to arrange a daily home visit for this patient. So providing a brief idea as to you're requesting a home visit. Similarly, when you're writing to a physiotherapist, or you may want them to provide different types of exercises. Not necessarily you would mention all of those types of exercises in the introduction paragraph, but you can just mention that he requires ongoing physiotherapy, or he requires say for example, you can say he requires further physiotherapy treatment to attain so and so. Similarly, if it is, say, for example, occupational therapist, you can similarly say that he requires, home hazard assessment or workplace assessment. So the basic idea here is that in the beginning of the letter, you can say, I'm writing to you today to refer this patient X who is now being discharged from hospital into your care. So it's clear that why you are writing this letter is because they are being discharged. And later in this letter, that means maybe towards the end or towards your body paragraphs, you can give specific instructions, okay, to the healthcare professionals on continuing care. So that can be mentioned in the later paragraphs, in the body paragraphs, right? So remember the purpose criteria For that, you need to do two things. First is your purpose should be very clear in the introduction paragraph. I would repeat that you can't just say I'm writing to refer, because refer basically does not give them the idea as to references for what. So providing a brief sense of what exactly you want them to do. So maybe ongoing physiotherapy, monitoring, further assessment, urgent admission, social support services. Say, for example, you are writing to a social worker. If you're writing to a psychiatrist, you can say a mental health assessment. So a brief sense of what exactly are you writing this letter for has to be mentioned in the introduction paragraph. That is one criteria, one part of purpose criteria, and another part is that it should be expanded. Now, what do I mean by expanded? Is anything that you think in your letter is not related to your purpose, okay, then omit that information. Say, for example, you are writing to a community nurse for four things: medicine, physiotherapy, say, for example, dressing of the wound, and the fourth thing, something else, maybe diet. And they have no role to play in patients, say, for example, habit of smoking or habit of drinking, or if they don't have any role to play in the patient's family history, then in that situation that information can be skipped. So the basic idea here is to you know to keep the purpose in the focus throughout the letter. Whatever information you are writing should be relevant to your purpose. So I would say, whenever you are reading the case notes, divide that information, that is there in the case notes for in a specific way. Try to bifurcate the purpose. Say, for example, I'm writing to a community nurse, that is ongoing care and monitoring. Now, exactly what I want them to do: medication compliance, monitor exercise regime, provide daily dressing, and assist with activity of daily living. So that is how I bifurcate my purpose into four separate things. Similarly, if I'm writing a letter to a neurologist, and I want him to take further assessment for my patient. So basically, my purpose is to provide them the background history, because otherwise, how would they assess the patient and how would they come up to a conclusion? So whenever I'm writing a referral letter for further investigation, my purpose is to provide background details. My purpose is to provide details of signs and symptoms and those things, which would help my reader to fulfill the purpose that I want them to carry out. Okay? So that is how purpose is. Now, the second criteria in OET writing, assessment, is content. What does that mean? First point in that is considers necessary information. Now, how do I decide necessary information? Is the audience awareness. What does the reader need to know? Again, don't think because they are a nurse or a doctor, they need to know this thing or that thing. Think from the purpose, to fulfill the purpose for which you are writing this letter, to fulfill that purpose, exactly what they need to know. That is why purpose criteria is looking at your ability to find out all the key information from the case notes. Another thing that it is looking at is accuracy of information. So here, if you have misinterpreted certain things from the case notes, and if you have misrepresented that in your referral letter, you'll be, your score in this criteria is getting affected. So again, content is looking at two things. It is looking at your ability to choose relevant information from the case notes, and it is looking at your ability to accurately represent that information. So if you have misinterpreted that, for example, um, in the discharge plan, it is given that you have advised patient for smoking and drinking cessation. And still, if you end up writing in your discharge plan, requesting that nurse that, please advise him or her on smoking cessation. So that is your misrepresentation of information. Similarly, say, for example, mentioning clear timelines. Okay, If you do not mention clear timelines and the information is not accurately represented, then this criteria gets affected. So audience awareness is key here. Who is your reader? And not just who they are, whether they are a nurse or a doctor, but what role they have to play. Okay, what is their role in the patient care? These are the two questions you should ask yourself to decide what is the key information that you need to include in your writing. So this mainly is when you are planning your letter during the initial 5 minutes, when you are extracting information from the case notes. That's when you have to keep these two things in mind. One is the audience awareness, which means for what purpose are you writing that letter, and if the reader has to fulfill that purpose, what information do they need if they are going to provide continued care. And second thing, you have to ensure that you are representing that information accurately without any errors in terms of content. So that's what the content criteria is looking at. Third criteria in writing is conciseness and clarity. Now let us understand what is conciseness and clarity. Again, itself, this criteria has two bifurcations. It is looking at two things. So conciseness is, uh, again here, audience awareness is important. What doesn't the reader need to know? Okay, what information is relevant to them and what information is not relevant to them. So basically, as per the old evaluation criteria, these two things were assessed under one criteria. Now they are being assessed under two separate criteria. So that is why now your ability to select relevant information could significantly affect your score, because you will get penalized in two uh, criteria. So what do they don't need to know? What is irrelevant for them? That is your conciseness. Okay. Conciseness, basically the dictionary word conciseness means how compact or how precise the information is. So it also considers whether unnecessary information from the notes is included and how distracting this may be to the reader. Two things, right? One is whether the information is irrelevant to the reader. Two, how could it affect the overall purpose, or how could it affect the overall clarity? So does this affect clarity? Is there any information that could be left out? So basically what happens is that you have a clear purpose in your mind when you are writing the letter, and your job is to expand on that purpose. Now if you tend to add a lot of information that say for example is not relevant, what would basically happen is the main information that is required for the reader gets dumped into the lot of irrelevant information. So that's a key here. You have to ensure that the information that you are choosing should be meeting the purpose for which you are writing this letter. So anything which you think could distract your reader from the actual purpose of writing should be eliminated from the case notes. You should not take those notes into your writing. Be very, very careful about this, because if you select irrelevant information, it would, one, increase your word count. The more you write, the more errors would be there, one thing. Two, it can completely distract your reader from the actual purpose of the writing, and therefore you cannot highlight. Say for example, I would give you one example of how, what do I mean by highlighting. Usually we all have that habit. If we want to highlight something, we write it in capital letters, or we tend to use highlighters. But obviously when it is a formal letter, you can't do that. Okay, you can't really write something in capital letters. It is the worst thing to do. You never ever do that. And you can't even use a highlighter. So how do you highlight that information if you do not have these two tools? So the solution here, or the way in which you can highlight main information here, is by reducing irrelevant information. If you eliminate irrelevant information, automatically the relevant information is highlighted, right? So that's the key here. It's very important if you think that the role that the nurse or the doctor is going to play in your patient's care, for that a particular piece of information is not relevant, simply exclude that from your letter. And second aspect of conciseness and clarity is looking at your ability to summarize. This is the most challenging part for students because they tend to write it like a story. Don't do that. Try to make it as summarized as you can. I would recommend to understand this criteria in more detail. All of you should refer to my another video on portal, which is paragraph construction, where I have basically explained how you can, write the summary in a concise manner. So again, here, if you tend to write too much information about, about past, which is no longer relevant or which is now outdated, it could affect the clarity of the information. I would again give you one example here. Say, for example, as you are writing a letter as a doctor, okay, and you are writing to a neurologist for a patient who has developed degenerative disc disease. Now, as a general practitioner, that particular patient may have visited your clinic, say, for example, 10 times, and for the similar back pain. So you may have 10 visits on the case notes, and all 10 visits they may have described how his pain has gradually worsened. So you may have tried by some, try to resolve it by giving some analgesics. And today, when you have identified that nothing is helping, and then you are writing that patient or you are referring that patient to a neurologist. So in that case, what you need to do is you need to provide a brief summary of all those 9 visits with focus on today's condition. So the information that is outdated, for example, when I say that his SLR on so and so date was this much, or if I say on so and so date ankle reflexes were present, or on so and so date the pain was not radiating to other part, do you think that would make any difference? No, because why I'm giving this referral essentially is for his today's condition, right? So summary is looking at your ability to pick up the main idea, and to exclude the details. Okay, so basically, say for example, if I give you a case note here where there are 10 visits, or similarly, this letter is being written as a nurse where your patient stayed in hospital, say for example, for 10 days, and then you will have 10 different notes where it would say on first day their condition was this, on second day it was this, on third day it was this, on fourth day it was this, and you are writing on the 10th day. So a good summary would be you just pick up the main information that during hospitalization they developed urinary tract infection and they developed ulcer, but they recovered successfully from it and the ulcer is now healing. Instead of saying that on this date, their temperature was this much, on this date, this antibiotics were given, on this date, the infection resolved. It's not important to just try to provide a brief summary of what has happened so far and expand on today's condition. Okay, expand on today's condition, whether today what is their SLR, today what is their ankle flexion, what is their pain level today, whether today it is radiating to any other body part or not, whether today the patient is able to walk, what is their what are the vital parameters today. So focus on today's condition, the day on which you are writing the letter, with a brief summary of whatever has happened so far. Now, that summary could be of 1 week, it could be of 1 month, it could be of 15 days, it could be more than that based on how long the patient has been visiting your clinic. But the main idea here is to summarize how well the information is summarized. So if you tend to write too much detail, like everything date wise or day wise, that is not a good summary, and your score in this criteria would get affected if you are not able to effectively summarize. Uh, okay, the next criteria is genre and style. Now, what is genre and style? Is appropriateness of language, such as register and tone, to the document's purpose and audience. Again, here, if you will notice, the all three criteria that we are looking at are focusing on the audience. That means your reader is in the focus. Okay, something that you are focusing on in your letter is the reader. Similarly, the examiner is also looking at your ability to, how well you have catered to the reader's requirement. So, what does this criteria basically assess? It is a similar letter. It is a formal letter, so it should not have any personal feelings. It should not have any judgments. Okay, and the tone that you are using should be professional. You should not be using informal language, such as I'm gonna do this, or the patient is getting this, or the patient is having this, or the patient puked, threw up. Those phrasal verbs are not acceptable. Spoken language is not acceptable in a formal writing. That is one thing. Second thing this criteria is assessing is the personal feelings and judgments. This has been now clearly clarified. We used to, sometimes students used to write, he is a heavy smoker, or he's a chain smoker, or he's a heavy drinker. I would recommend not to use those kind of terms, because basically those terms are considered as judgmental. Be factual. He smokes 10 cigarettes a day, he drinks 10 units of alcohol a day, instead of writing he's a heavy smoker or he's a heavy drinker. Avoid using judgmental language such as regrettably, unfortunately. Avoid using your personal feelings into it, because you are writing a professional letter objectively, factually. So I would say, if you want to remember what is being assessed in genre and style, I would say be factual and formal. These two things. When I say formal, avoid any kind of spoken expressions. When I say be factual, which means do not include your judgments, be objective, right? So again, another thing that this is looking at is the appropriateness of features. So depending on whom you are writing the letter. So if it is written to a medical colleague in a similar discipline, say for example, as a GP, you are writing to another GP, then you can judicial use of abbreviations and technical terms would be appropriate. Like for example, when you say BD, TDS, uh, blood pressure, BP. So those kind of things are okay when you are writing to another medical colleague. But if the medical colleague that you are writing to is in a completely different discipline, for example, when you are a specialist and you are writing to GP, then you should not use more of shorthand. You should not use a lot of abbreviations which are very specific to your branch of medicine. So as a pediatrician, when you are writing to a GP, you may not write a lot of terms that are more familiar with pediatricians and less familiar with MBBS doctors or the general practitioners. So keeping again your target reader in the mind. Okay? And again, if your reader is a patient, then again, it's very, very important not to use medical jargons. However, as far as medicine and nursing students are concerned, or even pharmacist, even physiotherapist, dentist, most of the time you will be writing a referral letter. Writing to patient is more common for pharmacist, though. Okay? Then the next criteria which is being assessed is organization and layout. What is organization and layout is your ability to group the information appropriately. So, as I have mentioned time and again, the uh, case notes, information that is given in the case notes may not always be given in appropriate or logical order. It, you know, may be given under certain headings. You don't need to necessarily follow the order of case notes as per the writing task or as per the case notes. You will have to decide logically what information would be prioritized. So organization and layout. Again, it has two parts. Organization is mainly looking at your ability to group the information, first of all. Say, for example, if I'm writing a discharge summary, and if there is one paragraph which is looking at their progress after the operation, or if it is looking at the patient's ability to move around the house or the patient's mobility. So in that case, all the relevant information related to mobility or related to exercise, physiotherapy, should be grouped together in one paragraph. A simple logic of paragraphing, for any document is to be followed here as well, where we try to group the information which is relevant to that particular topic, and then we put it into one paragraph. As the topic changes, we change the paragraph. So that is organization. Another thing organization is looking at is your ability to prioritize the information. Now that may differ from task to task, and it is your judicial judgment. You will have to judge based on that case notes what is the most relevant information for your reader. So it may depending on, say for example, if you are writing to an emergency registrar, the most important information they need uh, is maybe about the patient's current situation. Okay, and if, say for example, you are writing to a psychiatrist, they mainly need to know about the patient's emotional disturbance. Similarly, if you are writing to someone who is say for example, a social worker who is responsible for providing social support services, so in that case maybe social details are more important. So basically what we need to keep in mind here is that the information that you are organizing should be based on the priority. The most important information should be written in second paragraph, and then subsequently the less important information should come. So first is it is looking at your ability to clearly structure it, okay, so that it helps the reader to get relevant information. So how well it is organized. And second part, layout, is looking at your ability to provide a layout of a formal letter. So that is basically writing address appropriately, and writing the closing line, sign off, referral date, those things is layout. Organization is mainly how logically organized and whether the key information is clearly highlighted. So again, when I say clearly highlighted, doesn't mean that you will go and highlight that information, or it really doesn't mean that you will write it in capital letters, but you will prioritize that information, or maybe you will write more about that particular thing so that it is highlighted. And finally, language. There's a lot of misconception among students about this language criteria. OET is very different exam as compared to IELTS or PT or any other language test, because OET is testing your ability to use language in medical context. So here, healthcare professionals are concerned with linguistic features only to the extent that they facilitate or obstruct retrieval or information. So what this criteria basically looking at is your ability to write the language accurately, and it should not interfere with the comprehension or speed. That means any grammatical error which is creating a miscommunication or which is creating a misunderstanding for your reader would be penalized. Again here, it doesn't say that you should be using very fancy vocabulary. It doesn't say that you should be able to use a different variety of letters and different varieties of sentences. No. Uh, it should be used in a way which ultimately facilitates the reader to understand that information. So obviously, as I told you, the conciseness and clarity when I spoke about summarizing. So summarizing would be possible only if you are able to, use complex and compound sentences. Otherwise, it would not be a good summary. A an essential feature of a good summary is that it should have a level of complexity. It should have a compound and complex sentences, which would make it a good summary. And similarly, if there are a lot of grammatical errors, there would be no clarity. Similarly, genre and style. So it is written as a formal letter to a medical colleague. So obviously, it should not have all the very kind of a very simple sentences. So basically, your ability to use language accurately is being assessed through three criteria: conciseness and clarity. Because if you don't use compound and complex sentences, then it could not be made as a concise letter. If you have a lot of errors in grammar per se, then it would affect the clarity of the information that you are going to provide, right? Now let us understand how your examiner, yeah, would be looking at it. This we looked at from a reader's perspective, from a student's perspective. What as a student you could do to improve your performance. So now this is for we, the assessor. So purpose criteria is basically scored out of 3. Okay, and you need to score 2 here. So document is apparent but not sufficiently highlighted or expanded. The aim here should be 3 because the purpose should be immediately apparent and expanded as required. But to get B level, you can still manage to get B level if you have scored 2 out of 3 in purpose. Okay, so it's a very important criteria. Even though it is scored out of just 3, it can significantly affect your score in the other criteria as well. So keep reader in your mind and keep purpose of writing the letter in your mind. Other criteria, this 5 criteria are assessed out of 7. Okay, and your aim is to score 5. Okay, I would rather explain you what you shouldn't do. Right? So we would look at this two mainly because I have seen so far that most of you fall either into 3, 4, or 5. These 3 categories. None of you are, ever, never ever less than 3. Even if you have written the worst possible letter, it's still not less than 3. And it's beyond 5 is not necessary. Even if you are able to score 5, you can manage to get B level. So we'll understand mainly these two benchmarks, right? So what is 3? It says content is mostly appropriate to intended reader. Some key information about case or continue care may be missing. There may be some inaccuracies in content. Now it says some. That means some key information. Say for example, the suture removal is to be done. You have written the suture removal is to be done, but you have not mentioned when is it scheduled. So if I'm receiving this patient as a doctor or a nurse, when would I send this patient to your hospital, or when I would send them to follow up, right? So this is what accuracy is looking at. So inaccuracy. And 5 is that it is mostly appropriate to intended reader and addresses what is needed to continue the care. Content from case notes is generally accurately represented. So 5 is our target. Then conciseness and clarity, as I told you, it is the length of document is mostly appropriate and information is summarized effectively and presented clearly. So this is basically looking at your ability to exclude irrelevant information so that you can summarize it effectively and clearly. So if you include irrelevant information that distracts reader from clarity, then you lose mark, you come down to 3. And if you cannot summarize it, only partially you can. See, if you cannot completely summarize it, then it is 1. But if you could partially summarize it and partially if you fail, still you are at 3. So summarizing effectively is one of the key areas. Then in organization and in genre and style. Okay, what are we looking at is if it is inappropriate to the reader and if there is too much of technical language and abbreviations are used, then it could affect your score. But if you are able to use abbreviations judicially, and if you are able to be clinical and factual, as I told you, not to use judgmental language, a heavy smoker, a known case of diabetes, obese patient, uh, those kind of language, avoid using them. Use clinical and factual information. Then organization and layout. Okay, if you are able to organize information in proper paragraph, but if you're not able to highlight them appropriately, if you're not able to prioritize the information, then you end up getting 3, even if your layout is good, because layout is mainly copy paste, writing address and dates and those things. So layout, most of the students are able to score well. Mainly organization is something you should be careful about. So minor errors are okay. Within the paragraph, it is okay to have one sentence first and the second, but the relevant information should be prioritized to get 5. And language, see, very important this criteria is. Minor sleeps in language generally do not interfere with meaning. What is most important here is interpretation. If your errors are affecting the reader's ability to interpret the information, you are going to get penalized for it. So inaccuracies in language, in particular complex structures, cause minor strain. Even if they cause minor strain for the reader, you are going to get penalized for this criteria. So be very, very careful about not misrepresenting the information. Okay, use appropriate tenses, use appropriate vocabulary, so that it's very, very clear for them to understand. So our target is to get 2 out of 3 in purpose criteria and to get 5 out of 7 in each of this criteria. You must score equally on each criteria, right? It's not that you score 7 in content and score 4 in language. That won't work. You need to score a minimum of 5 on each criteria. 5 or more to get B level, and 2 or more, 2 to 3 in purpose criteria. But always aim high for the purpose criteria. And that would be way easier for you as well to select relevant information if you keep your purpose in mind. So I hope this video has helped you. And if you still have any queries, please comment, start conversation in the comment box, and I'll be able to guide you wherever you need my help. Okay. Bye bye. Wish you all the best for your preparation.